Hello, I'm Krystal Avalos, and this is Elaine, my daughter, as you may see. So, my topic is postpartum depression. She just woke up from a nap. Postpartum depression. I picked this topic because my mother has been through postpartum depression with my little sister after giving birth. Um, my mom wasn't able to bond as much with my little sister or like feed her or see her or carry her. But after a couple months, she started being closer to my little sister, started feeding her, sleeping her, spending much more time with her. And she started getting better from the postpartum depression. Postpartum depression is a depression suffered by a mother following childbirth, typically arising from the combination of hormonal changes um, and some motherhood fatigue as well. Some symptoms are being on a depressed mode, excessive crying, difficulty bonding with your baby, sleeping too much, intense anger, fear you're not a good mother, hopelessness, feeling worthless, shame or guilt, concentrating or making decisions, either not resting as much, severe anxiety and panic attacks, thoughts about harming yourself or your baby, thoughts about death or suicide. Postpartum psychosis may be like confusion and disorientation, obsessive thoughts about your baby, hallucinations and delusions, and paranoia as well. And this may be a rare condition that develops within the first week after delivering, and it may be very severe as well. With postpartum depression, you may have a lot of suicide like thoughts, and if you do, there is actually a hotline where you can call and they will talk you through it. The number is 1-800-273-8255 if you ever have suicide thoughts. Or you can go online to suicidelifeline.org/chat and they will help you out there if you have any thoughts about harming yourself, not killing yourself. There are also complications for the mother, for the father, and for the children. Some complications for the mothers are if you don't treat your postpartum depression, it can last for months or longer, may become a chronic disorder. Even when treated, postpartum depression increases a woman's risk of future episodes of major depression. Complications for the fathers. Postpartum depression can have a ripple effect. When a new mother is depressed, the risk of depression in the baby's father may also increase. New dads are already at a really high risk of depression, whether or not the partner is going to be affected with the depression. So it really doesn't matter if if they are new parents or not, they are still at a risk. Complications for the children are that children of maybe or who are not treated with postpartum depression are also more likely to have emotional and behavioral problems, such as sleeping and eating difficulties, excessive crying, and always it can always damage your or delay their language development as well. Some causes for postpartum depression are after childbirth, a dramatic drop in hormones, estrogen and progesterone, I believe, in are some of the hormones as well. In your body may be contribute to postpartum depression. Other hormones produced by your thyroid gland also may drop, which may leave you feeling tired, sluggish, and depressed, or maybe have even emotional issues. There is treatment for postpartum depression. Two of the treatments are medication and therapy. Either one can be used alone, but may be more effective when used together. Your partner, you, and your child. It may take a few tries to find out which treatment works for you, but keep communication with your doctor either way, just in case some other thoughts come into your head. Approximately about 70 to 80% of women will experience at a minimum the baby blues. Um, if you don't know what the baby blues are, the baby blues are feelings of sadness and women may have in the first few days after having a baby. Baby blues are also or may also be called postpartum blues. The reported day rate of clinical postpartum depression among new mothers is between 10 to 20%. So it's more like on the low percentage. And there is one recent study found that 1 in 7 women may experience postpartum depression in the year after giving birth, with approximately 4 million live births occurring each year in the United States. This equates to almost 600,000 postpartum depression diagnosis. Also, in my opinion, I feel like I, as a teen mom, I really had in my head like, oh, I'm going to end up getting that because I'm a teen mom. I have school. I don't know how to be a mother. I also thought like, what if I'm not a good mom? A baby is like a way different thing. It's like you would think to a lot of things like, how am I going to buy her things she needs, you know, like her diapers, her wipes, her milk, her food, everything. But then I didn't stress as much because I had a lot of my family was really with me. Like they would tell me to not worry, that a baby's a blessing. They will help me out with anything. So I really started being thinking positive. And after I had my baby, it was like the best thing ever, honestly. Like I would just look at my baby nonstop. Like I was very happy. And really just having my family there helped me out a lot, trying like not having postpartum depression. Their help has been everything, like can I have things for my baby, the things for my baby she needs. And yeah, like I feel like a lot of teen moms shouldn't stress out about it, or because they're gonna be young moms at a very, very, very young age. They didn't expect having a kid at their age. They still want to go to college. They have a lot of things planned ahead, but look at it in the way that you're going to try harder for your baby. So don't really stress about it a lot. And if you don't have like your family to be by your side, you always have friends, teachers, like adults that will be there for you and help you out in every way, shape and form they can. So I really looked at it that way. Like I was very scared to tell my mom that I was pregnant because I'm very young. Honestly, I'm very young. But then I looked at it in the way that I'm already pregnant. I cannot do anything to go back. And my mom was upset. At first my family was pretty upset, but then they started motivating me like, you're going to be a great mom, you should try a lot for your baby. And that's what I'm really doing. I'm doing it all for her and for me, but mostly for her. So try to not, if you're a teen mom or a first mom, don't stress about it too much. It is a little hard, not, I don't want to say hard, but a baby does need a lot of your time, so don't stress about it too much. um Always think positive. Try your best for you and especially for your baby. And yeah, this is my baby Elaine. But yeah, that postpartum depression can be very hard, but I